Okay, are you ready, doctor?
Yes, sir.
So I'm setting
Sir.
the time.
Time ta koto hobe 10 minutes, 2 minutes.
10 here, 10 minutes, 2 minutes. Yes, then 5-minute discussion. 10 minutes, 2 minutes, 5 minutes. So total 17. Okay, Nasim,
Start please.
start please.
Hello, I'm Dr. Azim, one of the doctor working here.
Hello, doctor.
So Mrs. Edwards.
Yes.
Just to be confirmed, you are the daughter of Mrs. Irene Singleton.
Yes, yes,
79 years.
doctor. Yes, doctor.
Okay, nice to meet you, ma'am.
Welcome, doctor.
How are you? How are you?
Really, doctor, I'm personally fine, but I'm worried for my mother, doctor, actually. And I'm very sorry to say that something happened wrong in the world. I'm worried for that, doctor. I don't know actually what I can do really, and what will happen to my mother, doctor.
Okay. Actually, we are also very sorry regarding what happened to your mother, and we are here today to discuss about that incident. So, can you please tell me that how much exactly do you know about your mother's condition?
Now, doctor, is that my mother having problem? She had pneumonia and she was under your treatment. And we actually conveyed the message that she's allergic to penicillin injection. And but why, I don't know that the doctor given the injection. Possibly, I'm sorry to say that you are the doctor that you have given the injection to my mother. And why you have given this is very dangerous, and what is the consequence happened to my mother really? Can you say me, doctor, please detail me, doctor, please tell me what is the condition my mother now, please, doctor, I'm worried.
Yes. First of all, I'm very much sorry that the medication was given to your mother, and I can understand that how much your mother is precious to, and you are eager to know about your mother condition. But at this moment, I can say you that your mother is far better than before,
Okay.
and she is more better than before now.
Okay, that's good, doctor, thank you. But can you tell me, doctor, why have you given this wrong injection to my mother, please?
Okay. First of all, I like to inform you that I was actually not aware about the fact that your mother was allergic to penicillin. Maybe there was some breaking of communication or some miscommunication, and which would not have happened in the first place. But I'm again I'm saying that I'm very sorry that such an unexpected event happened.
But you told me that there is an information gap. But where is the gap, doctor? We have already, our carer already informed in the triage room that this patient, my mother, is allergic to penicillin, doctor. Why it is not actually, I don't know, did you forget it or not? Can you say me, doctor?
Okay, actually, as I was not present at the emergency department at that moment, so I'm not in a position to comment actually what have happened there. But it might be that there is some communication gap, and as you know that there is always some rush in the emergency department. So I think that there must have been some miscommunication.
So you mean that, doctor, that emergency department doctor didn't give you the correct information?
Actually, I was not aware of the fact that your mother was allergic to penicillin. I was not informed about that.
You are not informed about that, but who didn't inform you, doctor? There is somebody else responsible to give this information, isn't it?
Okay, Mrs. Edward, actually, what matter is that here we worked as a medical team. So we all are equally responsible for your mother's condition, and uh, uh, and we are looking into the matter that actually in which where the communication was the communication miscommunication has happened. We are looking into that matter very seriously.
So, so what is your plan to keep my mother safe, doctor? You have given the treatment. You have told me that my mother is okay now. But is there any bad consequence may happen in future, doctor, in the coming days?
Uh, Okay, I'm again very sorry, and I'm assuring you that in future there will be no such comment. So no such mishaps should take place, as we have made some changes uh, regarding your mother's treatment plan. Um, like we have made some visible changes in your mother's file. uh, we have written in block letters on her file beside her bed, beside her cabin door, that she is allergic to penicillin, so that in future no one do the same mistake again.
Okay, doctor, then is it enough, doctor, to keep my mother safe from this bad
Okay,
happening,
we
doctor?
have already taken other precautions, like we have already crossed off the medication from your mother's chart, and we have already filed a incident report regarding your mother's incident.
Okay. So
We have
you talked me about that there was information gap really. So what you have done to overcome such problems so that the patients, those coming to your hospital, should not suffer from the same problem what my mother is suffering now?
kept, uh, uh, we have already informed her about the incident to our consultant and the ward manager, as well as the sister in charge, and we are going to raise the issue in our next mortality and morbidity meeting, which takes place monthly in the hospital. We are going to raise this issue in the next meeting, so that everyone become more alert about that such incident don't take place in the coming future.
That's right, doctor. That's right. But I want to say that now I understood that actually you are not much actually guilty for this happening, doctor. But it could be that before giving the injection, so far I know, you can make a test beforehand, doctor. Is not it?
Uh, okay. First of all, Mrs. Edward, I'm very much sorry that you are thinking that I'm not guilty. Uh, I cannot explain how much guilty I am. Even although I have to look after many patients, but after the incident take place, whenever I get a chance, I was beside your mother, so that I can observe her and also check for any further deterioration. I am again, I sincerely apologize for what has happened, and uh, and
Actually,
uh,
what you will do, doctor, in future, any patient came to you that you didn't find that information, patient is penicillin sensitive, will you do the same work without testing? Will you give the injection?
okay, I can understand your concern. Actually, we do a small skin test before giving any antibiotics, that whether if one is allergic to any medication. But yesterday, as when your mother arrived, she was not in a very good condition, and as you know that she was suffering from pneumonia, and the medication that we given to her, that is amoxicillin, it was given in good faith, in the best interest of your mother. But it was very unfortunate that she was allergic to the medication. So what we have learned from this incident, that we will be very cautious in the coming future, so that such mistakes don't happen twice. And I am again I apologize for what incident have happened.
No, doctor, you are right. The
2 minutes left.
2 minutes left. To apologize is good, but there is somebody else, doctor, who is the responsible for not transmitting the information. Please tell me who is that person. I like to sue against him, doctor, or her.
Actually, Mrs. Edward, we work as a team, and we all are equally responsible for what have happened. But obviously, there is, if you want to complain, we will be thereby with you in every possible way, and we will guide you to complain if you want.
That's good, doctor. I want these. I want these.
So, Mrs. Edward, you want to complain, right?
Why not, doctor? Because
Okay, sure.
the mistakes done in somewhere else could kill my mother, doctor. I'm not blaming you. I understood. You are very nice, doctor. Thank you, doctor, very much. But there is somebody else that they didn't pass the information to you. Maybe some nurses or somebody else. What do you think?
I'm very sorry that I'm not in a very better position to comment on actually who have done the mistake, and as we work as a team, so we are all responsible for that. And in that case, if you have to complain, so you have to make a written complaint in the hospital. We will help you by referring to the a independent service, which is known as patient advice.
Thank you. I think I have to come back. I have to come back to get the person name. Thank you, doctor.
Time up.
Time up.
Okay. Thank you very much.
Okay, doctor. That the thing actually you are willing to show the pathway to sue against any person or the system of your hospital. Do you think that ethically you are doing the right thing?
Sir, I think that as some error has happened and the patient is willing to complain, and it's her legal right to make a complaint.
Okay, that's good. But how the practical outcome of complaining against a person, and this daughter actually angry or worried regarding her mother's health. So what you can do just to refrain from complaining against the system or any other person, which will not bring any further benefit to her mother.
Okay, sir, I can offer her that whether she is willing to talk to the consultant or not.
Okay.
If she is willing to talk to the consultant, then I will arrange a meeting.
Okay, okay, that's good. That's good.
Yes,
that means it's not a physician's desire that to refrain from a person to sue against any person in the medical team, and just to convince the person that after suing against anybody or in the system, what benefit will happen to your mother, is not it?
Yes, sir.
That's right. So, doctor, was not possible that you could do a skin sensitivity test before giving this injection, doctor?
Sir, I'm not quite sure, as the patient was brought to sir, I'm not sure about whether
you are giving the penicillin injection, right? So before giving penicillin injection, could you not do a sensitivity test by yourself?
Yes, sir. It must be a routine test before giving any antibiotic
But
like penicillin.
why did you do this mistake?
I think, sir, it was a mistake which
It is
happened not
mistake by,
deliberately.
is it mistake by chance, or you were much busy in the ward?
Um, both.
Okay. Okay. Now, actually, what did you do after this happening? You have given the injection, you left the space, and how did you come back to see your patient again? And what you have done totally for this?
As soon as I have realized that the patient was allergic to penicillin, immediately I gave her intravenous hydrocortisone, chlorpheniramine, and
Okay.
metoclopramide. And after that, she was kept under strict observation at 15 minutes intervals to look for any further deterioration.
Okay. Any other thing did you do? Did you discuss with
Yes,
your
sir.
any senior colleague?
Yes, I informed to my medical team, and also I crossed up the medication from her chart and make some changes on her files written in block letters that she is allergic to penicillin.
Okay. Any other thing have you done?
And sir, I have also made a critical incident report.
Oh, that's good. That's good. So in the incident report, actually, what did you write?
Sir, in the incident report, it contained that time and date of the incident and details about the affected patient and
Okay.
what type of harm was caused to her.
Okay,
And
doctor. Okay. What is the aim of this filling the incidents report? What will you do or hospital will do?
Sir, this report will be presented in the mortality and morbidity meeting, and
So
which
will
is
anybody be punished after that?
sir,
Thank you, doctor.
after
Time
I'm
up.
up, sir.
Thank you, doctor. Thank you. Thank you very much. Doctor is to be very
Thank you,
speedy
sir.
to give the answer. If you think more, you are losing your time. Anyway, now answer this question, what I asked last time. Who
Sir,
will
after proper investigation, if anyone is found to be guilty, then I think it's up to them whether they are going to punish someone. At first, the team will investigate into the
what
matter.
is the actually usual idea, to punish someone or just to discuss and not to happen these incidents in future?
Yes, sir, discuss and discuss that such incident don't happen in future, and
So if anybody be punished and this is the system customs, so will there that the person will be very free to write this incidents report? What do you think?
no, sir, I don't think so.
So it is for discussion and not to happen in future, right?
Yes.
Okay. So you tried to make your actually the patient's daughter to make her quiet and calm. You tried your best, and she was very serious to sue against the person or someone. Anyway, and you actually possibly for your time you didn't try to refrain from that in a manner,
Yes, sir.
convinced that what is the benefit of suing against any person? We are dealing your mother with maximum attention and she is very quite okay now, and we will be trying our best, and our consultant also aware of these. Even then to take some legal actions or punitive action actually will bring some benefit, so that this mistake may not happen in future. There is a gap of information system given in the primary emergency room not to delivered or conveyed until up to the ward. So there is a mistake. It should not be repeated. Is not it?
Yes.
Okay. Thank you, doctor. Thank you very much. Now to hear something from our very alert examiner panel. First, Dr. Mesbah. Do you like to have any comment?
Okay, sir. I think candidate did well, but being feeling of guilty or sorry at the beginning, it was less, I think.
Oh, yes.
And later she candidate cover it, but I think it should be more at the beginning.
This apologic mind was not there initially, is it?
Yes, yes, sir.
They are something, but not adequate. What do you think? You are meaning that?
Yes, sir.
Dr. Farzana, got your point?
Yes, sir.
Apologic mind. What I like to say, new word I developed maybe. Anyway, any other thing, Misbah?
Candidate, sir, how are you? Directly to the attendance, and I don't know how much it is. Uh,
Is how are you to ask about a person in a standard, gentle, polite manner? But this scenario is different. That we will be talking to a person. Naturally, she is become angry, and better not to
yes,
start in that manner, Mesbah. Can you say, as Mesbah, how to start with?
okay, it was we can say about as a, we can ask, how is your mother today? Did you met her today's morning, or can you see her? And now, how much do you know about her today,
No,
or
that's
how
okay. But
she's
actually, patient
feeling?
is admitted in the hospital. Daughter couldn't see maybe in time. They are maybe visiting hour and other also. The daughter was informed that something happened wrong, and she is here to talk. May I ask Dr. Arif, please, which will be a better one
Sir,
to ask?
actually, I think that there should not be any formal, just informal way that how is thing going on, and what is she thinks about what she knows about her mother condition till now. I think it would be enough. No need to go any further in this
So can you play a
angry
role?
situation.
Can you play a role of telling this thing to the daughter? Just introduction.
Sorry, sir.
Can you
How?
can you play a
Okay.
role of introduction? Only introduction. Good evening, Mrs. Edward, like that. Can you
Good
start?
evening, Mrs. Edward. I suppose you are the daughter and next of the kin of Mrs. Irene Singleton, 79 years old.
Yes, yes, doctor.
So, I am Dr. Hussain, one of the medical senior house officer on this duty today. I'm here to talk about the health condition of your mom, Mrs. Irene Singleton. May I know how much do you know about your mother's condition till today?
I think better doctor before telling many things, only after identification, just to feel the sorry. That Mrs. Edward, we are very sorry
As the
actually. What happened
as the
wrong to
patient
your
party
mother?
already know that the as the
Yes,
patient party already know the incident,
yes,
and we
yes.
may start from the sorry. Yes,
Sorry,
I'm
better.
sorry
I
that
think
what
better.
happened
Not
You can say sorry and you can apologize from the very beginning. I think
very
you should
beginning.
apologize from the
Only,
very beginning.
only,
Very
only after
beginning.
identification.
We are
Only.
apologizing. We are really apologetic to you and your mom for the mistake that has been done on part of our team.
Yes, yes.
If we can start, but from the beginning, you should. These are the normal things that we need to practice. But sir, you have different thoughts. I practice usually in this way. That's why I actually put my
No,
ideas
no, no. That's not bad.
through.
We are not telling this is bad. I think just to make it better, in our discussion, make
Yes, sir.
consensus.
Yes, sir.
Just after
Yes, sir.
identifying that, hello, Mrs. Edward. Am I talking to the daughter of Mrs. Irene Singleton in our ward? So she said, yes, doctor. We are very sorry, Mrs. Edward. I am the doctor. Dr. Azim, and something happened wrong to your mother. We are very sorry on behalf of team. But I like to assure you that your mother is very nice, very good now. I think in that manner, I'm telling that you can
Yes,
choose
sir.
another good word, that your mother is doing very nice now. She is beyond the risk now. Because a
Yes.
person is waiting to hear something good news. Though she is angry, she is very serious to sue against other things. But most important thing is the life of her mother. I think it will
Sir,
be better.
I want to add one thing, sir, if you allow me, sir.
Please, please.
Sir, whenever there is an angry patient and there is a clear-cut mistake, so after apology, if it would be better, in my sense, that if we immediately tell that your mother had the allergic reaction, and we immediately stopped that medication, we administered such and such medications and contacted our specialist team, and she's under proper care and supervision of that team, and her condition is stable right now.
Yes, that's good. That's good. Yes, good. Because their scenario may be different. But Dr.
Yes,
Mesbah commented that already daughter knows about the condition, because it is written that is upset about this incident. But thing may be that daughter doesn't know. Daughter only knows that something happened wrong. At that time,
Yes.
how much you know about
Yes,
your
sir.
mother? How much you know about
Yes,
the mother?
yes.
But already daughter knows. Actually, better not to ask how much you know. Especially the scenario given to you in this scenario. So initially,
sir, actually, it's a part of that checking the understanding of that patient. So how can you overlook that, sir? That's my question.
This is not beyond the checking understanding. Thing is that the daughter knows about the incidents. Daughter knows about the incidents. So
but we need to show to our examiners that we are checking the understanding, sir.
This is one way. Structurally, you are right.
This
is structurally you are right. This is structurally you are right. But there is some bad incidents happen, and it is very clear to the daughter what the incidents, and she knows this, that the reaction of the antibiotic. Maybe nurses or other team informed her. For that, in the information is given, so we can a little come or go one step forward, especially in this scenario.
Okay, sir. Okay.
It is just to assure daughter first. Just make her mind quiet and calm initially. I think it would be a better one step measure in this scenario really. But checking the, it is very traditional. It is very traditional. But sometimes we have to modify our tradition also when we think that it could be a better thing. It could be a better thing. Okay, Dr. Fazana, do you have any query regarding your practice or performance?
No, sir.
So that's right. We can finish the topic now of discussion.